My name is Catherine Fairris, and the topic of my conversation today is the restoring skin firmness post GLP-1 agonist using endermologie LPG as a non-invasive solution. So a little background. My name is Catherine. I'm former president of the British College of Aesthetic Medicine. We've had the pleasure of having the endermologie machine in our clinic now since October last year, and it actually has been a revelation. We have had an organic influx of patients, and we're finding that it is a treatment that we can apply quite widely to a wide group of patients with excellent results, as I'll come on to later. So I'm director of the Wessex Skin Clinic and a founding faculty member of the Aesthetic Medicine section at the Royal Society of Medicine. So the learning objectives today really are to briefly summarize what GLP-1 agonists are, and their actions of mechanism and its reference really to the clinical effects on skin and skin laxity. I'll explain the physiology of post-GLP-1 weight loss causing skin laxity and the dermatological observations that we're seeing. And then we'll talk about the mechanism of action of LPG and the evidence base that supports LPG as a treatment for skin tightening. And finally, some practical protocols and 3 case studies of patients that we've had in clinic who've had successful outcomes. So we in the UK have seen a huge surge in prescription for GLP-1 agonists from people who are being prescribed for obesity and diabetes control, but also in my clinic, middle-class women who are getting access to GLP-1 to control their weight, who may not necessarily meet the criteria for obesity or diabetes. There's been, as a result, a rise in self-referral and clinical referral for body contouring and management of skin laxity. And quite interestingly, there was an article in the BBC this week, I don't know if anyone's seen it, about the problem where NHS prescribed GLP-1 resulting in weight loss and then ongoing skin laxity and patients being left without any support for the preceding skin laxity that occurs. So just to give a background, GLP-1 receptor agonists are essentially, they trigger, they mimic endogenous GLP-1. And what GLP-1 does, it activates a G protein coupled receptor that lives on pancreatic beta cells and hence regulates the production of insulin. It also has other clinical effects. It increases glucose-dependent insulin secretion, reduces glucagon. Glucagon is the main catabolic hormone. It delays gastric emptying, and it causes central appetite suppression. So it does have an impact on the brain. And as a result, all these combined mechanisms result in significant weight loss. It's probably the most effective weight loss mechanism we've seen in our time. And the common agents that we have in the UK are the semaglutides and tirzepatide, which we know commonly as Mounjaro, Wegovy, and Ozempic. So how does the skin laxity occur? Well, there's rapid, large volume loss. We know that patients lose weight, and we know they lose a lot of weight. I think last study, Mounjaro results in an 18% body weight reduction within 12 months of use. So this is significant weight loss that patients are experiencing. They also result in loss of support. If you're losing subcutaneous fat, which is one of the biggest sources of the weight loss, you're going to lose dermal support. And we're seeing that this can affect different sites depending on patients' age and genetics. There is also growing anecdotal observed facial and body changes. Everyone's heard the term Ozempic face, and we're seeing patients with significant volume loss and also concurrently, on a physiological level, loss of collagen and elastin. And there are potential surgical implications because these patients are, depending on the degree of weight loss, especially if they meet the criteria as obese, they will have a significant loss of skin, an increase in skin laxity and excess skin that needs to be removed. So there are potentially, we're seeing an iceberg where we're going to start seeing complications as a result of excess and rapid weight loss that these patients are going through. And hopefully this presentation will talk about how endermologie can be of some assistance in this process. So we're seeing many patients who are self-referring to us. My clinic's based in Winchester. We have 3 private clinics within a very short vicinity of ourselves who all prescribe Wegovy, Mounjaro, and have had successful outcomes. But one of the things that we're seeing arising is patients presenting with skin laxity and excess skin as a result. Many people are looking for alternatives to surgery. They want an evidence-based treatment option, and I believe that endermology will give them that. And it can be used very safely in conjunction with other modalities that you already have in clinics, such as lasers, radiofrequency microneedling, HIFU, ultrasound. So LPG is a beautiful adjunct that can add to your other treatment options for this potentially growing cohort of patients. What is it? What does it do? Oh, I think I've gone too far. There you go. So endermology is essentially, it causes mechanical stimulation. It is a system that uses motorized rollers and vacuum suction to stimulate and mechanically massage the skin. So the mechanical stimulation of skin and the subcutis has a direct impact on the fibroblasts, adipocytes, and lymphatic system. And it can ultimately improve circulation. It reduces fibrous septi tethering, hence cellulite, and can help to stimulate the extracellular matrix and its remodeling. There are there are more modes of action than that, but mechanotransduction is one of the largest modes of action. There's cyclical deformation, increasing fibroblast activation and increasing type 1 and 3 collagen synthesis and elastin expression. And we've got some really robust clinical studies that support this. There's also improvement in microcirculation and lymphatic drainage. And again, lots of studies that support its use in reducing interstitial fluid. And it can also help to improve microcirculation on a superficial level. And there's remodeling of the fibrous septi, so direct improvement of cellulite for those who are experiencing that as well. And the final two things that it does, it helps with body contouring. There are some nice studies, again, that demonstrate clinical trials and case reviews, short-term improvement in the appearance, and also, importantly, patient satisfaction ratings are very high. And then finally, skin elasticity and fibroblast markers have been studies, and histological studies show, as well as imaging, show that fibroblast proliferation and improvement in skin elasticity. Some practical tips in terms of its use. In our clinic, we are working on devising our own protocol for using endermology in this specific demographic of patients. The beauty of endermology is that patients can come as frequently as you can fit them in, which is great. It's a really, I'm beginning to name it my steady Eddie, because there's always somebody in the endermology suite having a treatment, which is great. You can look in your diary. If a patient's bought a course of 14 treatments, you're going to see them. And so that's really helpful from a business perspective. But typically, patients can have anything between, I would say, something about 8 to 16 or even more courses as a maintenance. But as a starting threshold, you can look around that kind of mark. Treatments last about 30 to 45 minutes each, so it doesn't take up too much time. I have a cool sculpting machine that patients can be with me for 8 hours if we do enough treatments, whereas endermology, it's relatively quick, but also effective. You can alter the settings, and that's really helpful for patient tolerance, and you can gradually increase treatment as the patient, as the treatment protocol goes. And there are also facial protocols, because obviously we have now growing evidence of endermology's use with aesthetics. So you can integrate LPG. I would say we have in our clinic seen an organic amount of patients arising who are stable on their GLP-1. So our protocol is to start in endermology, LPG, in patients who are stable. But there's no reason why you can't use it alongside patients who have just started at GLP-1. Commonly, we see patients between 3 to 6 months when they start to see a real improvement in their weight or a real reduction in their weight, because that correlates with when they start to see the skin laxity. So it's not that you can't use it before this time, but you probably won't see patients until they start to experience skin laxity. Hence your protocol, you can tweak it if you know that patients will experience skin laxity. You could probably start treatment sooner. And it's a conservative treatment option. it doesn't cause the patient too much harm, or if any harm. It's comfortable. Some patients fall asleep depending on the treatment that they're having. And as a result, it's something that can do, and we now have a growing evidence base for its holistic holistic improvements that it can have in terms of sleep and cortisol levels. And finally, when you're assessing these patients, it's really important to use the opportunity to talk about their nutritional status and comorbidities like smoking, because this will impact their treatment results as well as their ongoing weight loss. Like I said, endermology works nicely in any clinic that has other modalities of treatment. You can combine it very easily with things such as topical actives. We have a retinol cream that we can introduce in terms of cellulite. We have energy-based devices like RF and HIFU that we can introduce in terms of facial tightening. And your endermology will not stop patients having the other treatments. If anything, they can have endermology alongside all the other treatments, hence building up their treatment protocol. It is fantastic in terms of post-op, because not only do we have evidence that endermology has impact on scarring and tissue remodeling, it can be something that they can very easily start once they've had any sort of skin surgical removal as well. And as I mentioned earlier, it has improvement in sleep and cortisol levels. There is growing evidence on the wellness impact of endermology with reported benefits in patients beyond just appearance. Improved local circulation, reduced heaviness, improved limb comfort, and self-reported well-being and satisfaction. All our patients enjoy being there with endermology. There are some treatments you do and patients go, oh, but I love. With endermology, that is not the case. And so I think the take-home message with endermology is LPG is a non-invasive, low-risk treatment that can support body image during a very challenging phase of medical weight loss. And I think we're going to see a growing amount of patients organically experiencing this as the interest in GLP-1 agonists continues to rise. In terms of safety and contradictions and practical things, it is very well tolerated. I'll point you to the treatment that's happening now. There's a very sexy bodysuit that patients can wear. If you're just particularly treating a specific area, like a limb, like an arm, they may not necessarily need the entire bodysuit, but the bodysuit improves comfort. It prevents the machine from grabbing onto the skin too tightly, and patients, they find it interesting, they find it funny, but it's a good, easy to use piece of equipment with very few consumables. That's the other thing to say. When you have a machine, sometimes these machines, they're so expensive, but you need so many different consumables every time you treat a patient. Endermology, that is not the case. It's a really easy treatment, really comfortable, with minimal consumables, minimal downtime. I just take this opportunity to talk about some case studies that we've done. I have 3 to talk about. My patient demographic, as I said, are not necessarily obese. They are patients who are taking it upon themselves to start using GLP-1 agonists, and they presented to us with increased laxity in their skin and wanted to know different treatment options that we had. This patient is a 61-year-old lady who presented and didn't like this sort of bingo wings effect that she started getting. I'm sorry, the screen's quite tiny, but you can come around and have a look. And she had a course of 12 45-minute sessions doing upper limbs and lower limbs. And I would point you to the second picture. I apologize, they're not standardized images, but have a look, if I may, have a look here. I would argue that you can see between picture of the before and the picture of after, there is improved tightness in her arms. And that is after a course of 12 over a period of about 3 months. I would have loved to put her against a black screen with gradiated markers so we could see the degree of change. But I must admit, when we first got endermology, I never expected there would be such significant results or that I'd be presenting our results. So they're not necessarily standardized. But what we're also seeing is patient-reported satisfaction. She feels better, and we can clinically see that her upper arm looks tighter. And to be honest with you, when patients are spending money, that's the most important thing. Do they walk away feeling happy and that their treatment has resulted in an improvement? Again, I apologize about the quality of this. She's in her underpants. But this patient is really interesting. She's 68 years old and she doesn't like her banana rolls. She didn't like her banana rolls after going on GLP-1 agonist, felt she had more cellulite on her legs and felt her bum was a bit saggier. So she's been coming for clinic and she's had a course of 14 over a period of about 12 weeks. Now, if you see, when you put your arms up, it pulls your skin tight around the sides. So we've got her to put her arms down in the second picture, and even with her arms down, there's an improvement in her banana rolls, and there's an improvement in the cellulite across her back, and I'm sorry, but also across her bottom and the backs of her legs. She also then, completely coincidentally, reported an improvement in her legs, feeling less heavy. And so she's now booked in for more treatment because she's having improvement in heaviness in her legs, which wasn't something we asked her or tried to sell to her. That was an organic improvement in outcome. And then finally, this patient came to us. She'd had weight loss with GLP-1 and had a degree of treatment with core sculpting with us in an attempt to treat the pockets of stubborn fat that was left, and it left her with quite a degree of excuse me, there you go, what she felt was sort of cellulite, loose skin across her abdomen. This is her later, and I'm the first to comment on images that aren't standardized and aren't the right photographs, and I apologize profusely. But like I said, we didn't intend for the photos to be shared. They were just for patients to see, and actually they were mostly taken by my therapists who performed the treatment. But what I would argue is you can see she's almost got abs. There's better definition to her abdomen rather than what she had here. So again, that's another organic result using, I think she had a course of, she had hers over 6 weeks, but she had a gap in the middle when she went on summer holidays. And so it was from July to September. And that really just some practical takeaways. I think we're going to see a rise in GLP-1 agonist use. We know, and there's emerging evidence, that GLP-1 agonists are very effective in what they do, but they're leaving patients with excess skin laxity. And there aren't many treatments out there that can support patients through this time. Not everybody's a surgical candidate. Not everybody wants surgery or can afford surgery. So having a non-invasive treatment option that may, and don't get me wrong, I'm not promising that these will completely remove all the cellulite and completely revert their skin back to what it looked like when they were 20. But the patients aren't looking for this. They're looking for support. They're looking for improvement. And it's a very easy, safe, minimally invasive treatment that can be used as an adjunct alongside other treatment. And it has a growing evidence base and already has a wide evidence base supporting its use in a lot of other clinical scenarios. So when you're buying a machine like this, yes, this will help, but it does other things like improving the outlook of scars. And we're getting more information about wellness, well-being, cortisol, sleep, menopause and perimenopause. So a versatile piece of kit with a low consumable requirement. And that's it from me. Thank you. Yes, of course.
Hi, Catherine, thank you for that. You're amazing.
Oh, thank you.
And your results are incredible.
Thank you.
I just wanted to ask, in terms of client satisfaction and retention, how do you feel the relationship with your clients are since introducing LPG?
Thank you. I was actually surprised by the degree of satisfaction. And one of the things I want to do is do a patient satisfaction questionnaire at the end of the course of treatment, because organically patients are reporting that it's effective. And what they like about it is you can pop in and have a 45-minute session. There's no downtime. It's comfortable. And the other thing that I've noticed is it's a great opportunity for your therapist to get to know your patient quite well. They've got 45 minutes together, and so there's a lot of conversation. It's a great opportunity for them to talk about other things, such as other skin health, and the patient that we talked about with with the heaviness in her legs, that came about as a conversation with a therapist organically in the room, she was saying, oh, do you know what? I noticed my legs are less heavy after treatment. And she goes, oh, and the therapist was able to say, yes, this is and she was like, right, I want more. So I think it's a really nice addition. It's a steady, we're all a business, so it's a steady income provider. You can set it as packages, and patients are typically quite happy with the results, especially if you choose the patients correctly and set realistic expectations.
Thank you for that. That's great. You're amazing.
Oh, thank you. Thank you very much.